So first one we're gonna do are called cat-cows. The idea is you're going to kind of use your scaps to first push away, and you want to round out in your upper back, like roughly here. So you're gonna really push the floor away, and then you're gonna extend in that same area, really focus on that, and let that chest kind of drop through actively, and you can even pretend to pull the floor to kind of get a little bit of extra range of motion. With any of these, you're gonna go to the pain, but not through the pain. And so the idea behind that is if you get to a 4 out of 10 pain, stop. 3 out of 10 or less, good to continue. So the next one is called Thoracic Rotations. You're gonna be in the same quadruped, 1, 2, 3, 4 quad position. You're gonna take your hand, place it behind your head as best you can. And what you're essentially gonna do is you're going to rotate throughout your spine. It's not really a shoulder motion, although that's gonna go with it. It's gonna be your entire spine that's rotating in either direction. With all of these, it's important to explore end ranges. So go as far as you possibly can within the pain tolerance. So the way you're gonna do these is you're gonna hand behind the head, rotate all the way through as far as you can, and then you're gonna use this arm, push yourself away, use your spine and your back muscles, and really open up top. Come down and reach as far as you can, and come back. You're kind of pushing a little bit against your hand, very gentle, nothing crazy. It's really just about getting that thoracic area to open up. And then you're gonna switch sides and do the same thing. Okay, this one's gonna be a little more involved, and what I'd recommend is you get a band, a really thin band. This one is actually a little too strong. I'd recommend the thinnest you can get. They're cheap online, or if you have one, that's perfect. If you have a heavier one, just put less tension through it, that's all. And you can also always use your hands as well, or really anything that has a little bit of stretch. A shirt actually works quite nicely for these, if you really need to. So the first one we're gonna do, consult the list, is we're going to do our quadruped banded retraction isometrics. It's a lot of words describing not much. So the idea is same quadruped position. You take the band, put it around the head. You're gonna feel, if you palpate around, this like ridge, this bony ridge of the occiput. It's a nice little hook under there. I'd recommend kind of going over the ear, because like on top of the ear, under ear is really uncomfortable. Little tiny bit of tension, and place your weight in your hand so you don't have to hold the band. So what you're gonna do is you're gonna first just relax into it, and this is gonna be not where you start. So the idea is you're gonna do the chin retraction, and just like we did before, we're gonna extend through our thoracic spine. So it's gonna be like a retract and extend, let that chest be proud, and we're just gonna hold this for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. I'm gonna relax, count to 10, and then we're gonna start again, go back to position, hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. That's all that is. Okie dokie, so the next one we're gonna do, kind of along the same vein, is if the isometrics are easy and it's below the 4 out of 10, and you can do all the prescribed sets and reps, then skip all of those and substitute the isometrics, so the lack of motion, the hold, with the motions that we're about to do. It's the same thing as the one we just did. The only difference is we're gonna be moving the whole time eccentrically and concentrically, like we're lifting a weight. So once again, toss the band behind your head, wherever it's comfortable, weight in your hands. You're gonna kind of relax into it, and then retract and extend, and down. You wanna do a 3 seconds up, 2, 3, pause the top, 1, 2, 3, 3 seconds controlled, down, 2, 3, and then right back into it. 1, 2, 3, pause, 1, 2, 3, slowly down, 2, 3. Okie dokie. Another quadruped move. Very similar, but different directions. So we're gonna do rotations with a little bit of lateral flexion. So what that means is we're gonna have the band around our head in a minute, but essentially what you're gonna try to do is a little bit of that extension that we were doing, just a little bit, and then you're gonna essentially rotate your head against the force of the band in either direction. Except we're just going to hold the head in that position. So rather than words, let's actually take a look at what that's gonna look like. So again, band in the hands, around the head, wherever it's comfortable. Weight on your hands. This is actually a little too much force. But instead of having your hands out here, you're actually gonna want to bring them closer. Or you could even just give them a nice cross or a little twist. And then go back to your wide position. So what you're gonna do is you're just gonna gently rotate, might press on your nose, and you can always move it. You're just gonna hold 2, 3, 4, 5, 6, 7, 8, 9, all the way to 10 seconds, and then relax. And then we're gonna go back into that position. We're gonna count to 10, and we're gonna relax. Always gotta do the other side. Count to 10, relax. Count to 10, one more, hold for 10, and then come back down and relax. These ones get kind of awkward. The other way to do it is actually just, you can sit, you can stand, it's the same situation. You have your hands out front like this, and you could even make it easier by bringing it out to the side and trying to rotate in that position. You might find this a lot easier because you can actually keep your head straight and rotate against the force of the band. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can do the other side. Rotate against it. 2, 3, 4, 5, 6, 7, 8, 9, 10. And if you prefer to do it this way, it's actually going to be a little bit easier because that means you can hook this on anything around you. If you are ever going to hook a band though, make sure the object it's on is heavy, stable, and has a good piece of it that you can toss the band around. I have a table right here with very perfect arms or legs for that. The only problem is it's not heavy, there's nothing heavy on it, so if we do that, it'll drag the table with us. If you're gonna put it on a door handle, just tie it down extra strong. Nobody wants a good thwop in the face with a band. Okay, last but not least, I bet you could have predicted exactly where we're going. Doing the rotations again, but this time it's going to be dynamic. So we're actually going to do the motions, just like the last one with the retraction and extension. Basically, if you can do all the sets and reps for time, and it's below the pain threshold, again, 4 out of 10, call it, 3 or less, good to go. Then we're going to progress into the dynamic parts. So we'll start with the quadruped, in case you like this more. Go ahead and cross it a couple times if you like. Wide hands, doing all the same stuff, right? So a little bit of retraction and extension, and then we're gonna actively rotate, 2, 3, pause, 2, 3, slowly down, resisting it, 2, 3, other side, 1, 2, 3, up, pause, 2, 3, down, 2, 3, other side, up, 1, 2, 3, pause, 2, 3, and down, 2, 3. All right, and then just to recap, if you did prefer it in your hands, again, cross, maybe cross again, or if you're gonna have it out to the side, that works too. So this time you're going to actively rotate against it, and back, up, 2, 3, pause, 2, 3, down, 2, 3. So with this one, you're gonna get a little bit of a lateral flexion moment arm. That might be a little aggressive. If it's not, that's awesome. More is always better. We always go 1, to the pain, not through the pain, but two, we do the hardest thing that you can do well. That's always the rules, the hardest thing that you can do well. So this is gonna be the most challenging. This will be the second most challenging. And then this will be the easiest. As always, let me know if you have any questions.